Hey, welcome back to our series on low back pain. We're talking today about our number 2 cause of low back pain, also very underdiagnosed. And this is actually lumbar facet arthropathy. So what is a facet? We can bring back our friend Tiny Spine and to demonstrate where the facet joint actually is. So if you look at your different levels of your spine, it's the joint where each level comes in contact with the one below. There's a facet joint on either side of your spine, and that really helps us diagnose when this is the source of the problem. Because of the location of this joint, the pain will be aggravated with any twisting type motions, any side bending type motions, and then really exacerbated with the combination of those. So twisting, side bending, and extension that really maximally compresses this joint back here. Those joints become affected when there is poor movement patterns. So one of the best things that we can do in treating and tackling this particular condition is working in conjunction with a really good physical therapist that is targeted towards treating chronic low back pain. And one of the reasons for that is we found that there is actually a misfiring of the musculature in the area that leads to compression of this joint and the wearing down of this joint over time. So while I can get in and do some magic with some regenerative injection therapy, really the long-term fix from preventing that from coming back is going to be working with a movement pattern specialist to get all the tiny muscles in the area firing appropriately so that all of those joints are moving appropriately, preventing any further damage. One of the reasons that this particular condition is often confused with pain patterns coming from a herniated disc is because you can have symptoms down into the leg. And the reason for that is because of the proximity of this joint to the exiting nerve root. Inflammation of the joint will affect the nerve root as it passes by, causing symptoms down into the affected side. You'll be able to tell from the types of movements that aggravate whether that is coming from a herniated disc or whether it's coming from the joint. Another reason for that correlation of the joint problem with radiating pain is because of the way that the joint itself is innervated and how that feeds back into the nerve root. So actually addressing the joint should take care of the radiating symptoms as well, if that's where your radiating pain is coming from. Now, how would you know that this is actually what's going on? A lot of times, again, this is kind of misdiagnosed as pain that's coming from a herniated disc or a desiccated disc. And I'm actually seeing that radiologists are becoming a lot more savvy on actually commenting on the facet joints because we are seeing them as sources of pain. So the best imaging to do for this particular condition is an MRI. You may find that your provider is going to order an x-ray before you get to that MRI, and a lot of times that is because of insurance. Insurance will not typically pay for an MRI until you have evidence that there's no bony abnormalities. But an x-ray is not going to show really enough detail of this joint to make an accurate diagnosis of facet joint arthropathy. With this particular condition, again, like I said, you'll have aggravation of your back pain with any twisting type motions, any side bending type motions, or a combination of those motions, kind of bending backwards, which are all movements that your provider should take you through when they're trying to kind of focus in and figure out where your low back pain is coming from. Once they've taken you through all of these motions, done an MRI, really taken a look at the facet joint itself, and we've identified, yes, there is some pathology going on here. What do we do about it? Again, this is one of the places where regenerative injection therapies can be extremely helpful. Getting into the joint itself, administering a little bit of prolotherapy solution can really help, one, stop the ongoing breakdown of the collagen tissue that is making up the cartilage inside of the joint. It can actually help rebuild and repair. Beyond that, if we identify that there is actually any issues with the musculature, if that's been going on long term, one of the things that the body does is actually lay down fatty deposits in the musculature itself. That we can see on MRI, we can also see under ultrasound. To help rebuild that musculature. Definitely engaging it in active exercises is going to help bring that musculature back. But there's also platelet poor plasma injection therapy that we can do that really helps stimulate that muscle regrowth. So this is usually done in conjunction with treating the joint itself to try and address in a holistic fashion, all of the issues that are going on. So that really wraps up kind of how we identify, how we properly image, and then how we treat a pathology with your facets. If this is something that may be of concern to you, definitely get in, be evaluated by someone who understands back pain. And if you think this might be valuable information for a loved one in your life, feel free to go ahead and share this information with them.